Next, from the state capitol, Senator Dale Ryder and Representative Patti Bellock expressed their opposition to Governor Quinn's plans to expand Illinois' Medicaid rolls, a move the two legislators say the state cannot afford. This runs about 15 minutes.
It's necessary because we need to remind people once again that this is a program in crisis, that while Governor Quinn and the Democrat leaders sang the song of reform loudly in 2011 and 2012, that since then we've had a walking back of those reforms, and now again in meetings that they are having, they are planning the expansion of Medicaid reform, the unreform, if you will, of Medicaid reform, against the backdrop of their claims that they've done all they can to save money in the state, and therefore the 67% tax increase must remain in place. Now, there's a laundry list of issues we could talk about, but I just want to talk about two. When the SMART Act was passed in 2012, two of the most significant reforms, and one had been touched on in 2011, were the third-party verification system and the full implementation of managed care. The goal of 50% of all Medicaid enrollees being in a managed care program by the end of this year was put forth and hailed by the governor and by Democrat leaders as a reform that would save this state hundreds of millions of dollars down the road. 50% by the end of this year. As Representative Bellock said, we are not even to 20% right now. So they have clearly, if not given up on that reform in word, they have given up on that reform in actions. Second is the third-party verification system. That was the cornerstone of the SMART Act, to make sure that only people who meet the criteria to be on the program and really need the assistance are the people actually on the program. That program, just to remind everyone, in its first few months of operation was a stunning success. It even exceeded our expectations as far as rooting out the fraud and abuse in the system. 4 out of every 10 individuals, 4 out of 10, were found not to be eligible for the program, which should be a success in anyone's eyes, except for Governor Quinn's. After the state's largest public employee union challenged that, he gave up on that reform. He walked away from it. He signed a deal with that union, and now that reform is, for all practical purposes, is wrong. So again, when we hear time and time again from Governor Quinn, from the Speaker, from the Senate President, that we've done all we can to tighten up this program, to shore up the integrity of this program, that's why we need to continue to take more and more money out of Illinois families' pockets. Think again, because the facts tell us something entirely differently. So with that, I'd be happy to answer any questions.
So you say 4 out of 10 people found not eligible, but a lot of them are coming back because of they did get the mailing returned in time. That's what DHS and HFS are saying, right? That that's somewhat of an illusory number because people end up coming back because they really were qualified. And the next time they go to their doctor, they get kind of re-put into the program.
Well, but we've not given a number on how many of those are actually coming back. So what's a lot to them? I mean, they're trying to sell the case. Well, that means 2/3 didn't belong on it. So that reduces maybe the number from 4 out of 10 to 3 out of 10. That's still a stunning number, 30%. I mean, you're being told that, and we're being told that because Governor Quinn doesn't want to go forward and stick to this reform in an election year when the state's largest public employee union, who supported him 4 years ago and is going to try, I assume, support him again in 2014, doesn't like it. But we think the integrity of the program supersedes those political concerns.
How are your plans affected by the federal expansion of Medicaid?
Well, that adds to the problem, really, in the budgets, because we were drilling yesterday in the HFS working group as to exactly what is the cost, because we now know that there's going to be almost 400,000 new people coming in by the end of July, probably. Okay, so you're adding that to a system of 3 million people already, and even if they're at the 100% match, of which we know now that there's at least 80,000 coming in at the Woodwork population, and that's the old match. So the administrative cost to that at all. There is no number on that whatsoever. And so that will be a big problem in that what is the cost of that in this budget when nothing has been put in there as this budget covering that as far as what we could see yesterday when we went over the numbers. So you're looking at that huge expansion. I don't know how much that's going to cost the state. And we went over this and over this when we talked about the Medicaid expansion, that maybe the concern was, besides several other concerns, was to hold off for 6 months or a year to get the state in better fiscal order before we took on the huge population, and whether we can manage it. Because in the DHS offices right now, before Medicaid expansion even happened, you have, in my local office, you have 2,500 people to one case manager. You can't even get a phone call through. And now you're adding 400,000 people throughout the state onto that. And you can bet that there is a lot that needs to be done in that area. By letting go of the Maximus contract, I think even the other side of the aisle would recognize the fact that if we had those 500 employees still on doing the eligibility, that would free up because they need to hire, they have 1,000 new people that they're going to hire. But they can't hire those people fast enough to address that 400,000 people coming in. So you're going to back up those local offices even more, and that's the most vulnerable population that needs the help.
What about the money they
I
spent
want-
in the first 3 years that would pay for the new Medicaid costs?
I want to talk about the expansion for just a second, the federal expansion, because remember, we passed a moratorium. I mean, we're back here talking about we need to extend it and broaden it. We passed the moratorium. The ink on the governor's signature was barely dry before the Democrat leaders put forth a plan to add childless adults only in Cook County. So just as we had all got together and held hands and said, yes, we need to hold our breaths for a little while, for 2 years, and not expand a program that is bleeding, they came around and said, no, we need to add childless in Cook County. And then, even though the United States Supreme Court had given us relief from the Affordable Care Act or the Obamacare mandate to add all childless adults under a certain level of income, what did Illinois do? What did Governor Quinn and the Democrat leaders do? They said, we'll do it anyway. And so, again, while we were singing the song, at least earlier, about the fact that we had to stop expanding the program, they then again took on a massive expansion of this program where you have hundreds of thousands of people being added to a program at the same time that that Governor Quinn and the Democrat leaders are telling you we don't have enough money to pay for anything else. That's why your taxes need to continue to be increased.
Can I make a comment just on that program alone? Because I met with Tony Prenkwinkle, and that their numbers came in so fast, and the DHS workers were doing it. They had 50 DH workers. They couldn't handle it. They were so far behind. Added on 25, added on another 25 at Cook County's expense. They were still almost 6 months behind from the beginning, and that was working off a population of 100,000. So you can imagine what it's going to do to our system in backlogging the bills for the providers when you now have 400,000 people coming in, and you don't have that many more people on the rolls to do that.
Patty, in your discussions in the social grouping appropriations, are you getting any satisfaction as to what the numbers are that you need to get to and whether there are actual dollars there to do what the programs are?
Well, we went over that and over that yesterday, and I just didn't get any satisfaction on that. You know, they said the numbers are in the budget. Some of them said that, some weren't sure. But the bottom line is, I don't see it. You know, so I don't know how you take in that huge of a population and you don't see a major blip up. And then you deal with, you know, the collective bargaining and all those increases in those budgets. That's there. You can see that very easily. I can't see how 400,000 people coming in is in that budget.
Ask about the managed care target, 50% end of the year. I had a conversation with Director Hamlis last week. She indicated that she was optimistic they would be able to hit that goal, even though it is a bit of a stretch. She was talking about these new coordinated care agencies coming on with private companies. What are you hearing that they're not telling us that makes you more skeptical of that?
Well, that they're under 20%, and we've got just a few months to go before getting to 50. I mean, and I appreciate the director's optimism. I'm not sure how well grounded in reality it may be. One thing they have tried to do, which we have objected to, is water down the definition of what exactly is managed care. I mean, if you change the statutory definition, then more people who really aren't, who their care isn't really being managed, get counted into that number. They did that last year through Senate Bill 26. We'll see if they try to do that again with whatever comes out of the Medicaid expansion working group that the Democrats, the meetings they're holding upstairs here in the building. So I think that this is a very, very difficult goal to achieve unless they decide to change the definition of the target that they're shooting for.
What's the definition of it statutorily and what do they want to change to?
I can't quote it there's some things I can quote off the top of my head, but the definition of what managed care is in the Illinois law is not one of those. But it would make, what they would do, what they did in Senate Bill 26 is they expanded what managed care means. Insofar, so more and more people who maybe weren't in managed care then fell under the statutory definition, so then they could bump up their percentage. But I have no idea what that might be.
I can comment on that a little bit. And, just in the last couple of days, actually, since I've spoken to a couple of you, we've, been abreast. And I will say Director Hamos has been extremely busy because she has had the entire Affordable Care Act, the entire Medicaid expansion, and now all of this with the managed care. And the hospitals and the nursing homes have been working with them. They're in our offices all the time. So when you talk about that, the whole idea is the care coordination. And so they have some new innovative things called ACEs, CCEs, but there's a whole definition, and that's what's complicated as to what the savings to the state is going to be. Some of those things, it's still that is responsible for that. If you talk about ACEs, for the first 18 months, the state will still be responsible. An ACE is like a hospital system that is now going to provide by themselves what usually would be in an HMO. They have to provide primary care physicians, mental health services. There's 4 or 5 things that are mandated through that. So there's going to be variations, and those programs, it's going to take 2 years to find out how that's going to happen. They have been innovative in some of those programs, and I think in taking the time for the innovations, I think there is something like 7 or 9 ACEs, what they're calling ACEs. There's 9 private groups that will be in the what we now are calling MCOs. So it's a complicated process. But when we reviewed the other day that we only have 6 more months left to meet that 50%, and we're only at 16 or 18%, that is not the implementation that the goal was for us to get to. And so that's why we're moving forward today and putting more pressure on that we need to achieve those goals in order to get the savings.
And what practical effect would this moratorium have? I mean, does that mean that no more signups for the Affordable Care Act or something? I mean,
Oh, no.
Help me understand what that would be.
No, it would stop the expansions that are being talked about in the Medicaid expansion working group that the Democrats are hosting upstairs.
Like adult dental services bringing things.
It would stop whatever. It would recognize again the reality the Democrats, Governor Quinn and the Democrats said they recognized a few years ago, and that is this program can't pay its bills. It's not being responsible with regards to who's on the program and who's not on the program. So we're going to stop saying we're going to do more until we can do what we can afford to do, according to the law right now. We have a question. Someone calling in with a question? Any more questions? Anybody?
When you talk to, I presume you talk to, say, Senator Cullerton, the governor, how do they, what is their version of what they're doing and why they're not ruining the program as you've laid out?
Why they're not?
I think the main thing is, there have been problems with different groups saying that this needs to be done or that needs to be done. But the bottom line is there were major reforms in there. We had 6 months of talking about those reforms, and we feel that they need to be implemented. The biggest disappointment of all to Senator Ryder and I was the Maximus contract, which is what we needed at the time to have an outside vendor who could actually say, so it wasn't like it was political, it wasn't from within, and you were able to get those people hired immediately. That would have been very helpful, especially now with what's happened with the huge Medicaid expansion. So those are things, we could have pointed to, our goal was $350 million worth of savings, 350,000 people. Easily probably could have come off. It was showing there that could have come off within, the first 2 months were a little slow. After that, it was moving right along, as everybody saw. And then to stop that is just totally beyond, recognition. Every single person was recognizing that what we put in place was working. And Secretary Hamos, or Director Hamos, pointed to that since, and she came into our APROP meeting this year to point to exactly what they had done in that. And I said at the time to her, I said, had we been able to move forward with that, we probably could have made that a $1.5 billion savings.
Thank you.
Thank you.
You're watching the Illinois Channel.